Good afternoon, everybody. Today is Friday, January 29th, and I am joined by Susan Engel, who leads infection prevention here at BAYADA, standing in for Nora Triola. This is your CEO weekly update during the coronavirus pandemic. I'm going to go ahead and share my screen, and we're going to kick off with Susan sharing some real important safety strategies, particularly in an environment where we're starting to see vaccination pick up momentum. It's a key reminder that vaccination is not the only thing keeping us safe out there. Susan?
Thanks, David. I'm happy to share a new resource available to all of you today. This new resource tool describes BAYADA's core safety strategies to keep both you and your clients safe. And it begins with our basic core general infection prevention strategy. This is what you've always done prior to COVID to keep you safe and continues to be the foundation for safe care. These are those infection prevention strategies that you read and learned about at orientation, annual re-education, reading the Staying Healthy, a guide to infection prevention, and includes our standard precautions, wearing those personal protective equipment such as gloves to protect your hands from contamination from potentially infectious substances, and other PPE to prevent the contamination of your clothing, splashes to your eyes or mouth. Good hand hygiene, cleaning and disinfecting surfaces, avoiding touching that T-zone, here, your eyes, nose, and mouth, and staying home when sick. And then we have another core strategy, which is required PPE. And this is related to increasing our personal protective equipment during this pandemic, as outlined in our PPE standard at a glance. So you all have been wearing successfully our surgical masks and eye protection for the care of our clients, as outlined in this strategy, and it's been effective, especially when we implemented that eye protection in reducing the transmission risk for our asymptomatic transmission of COVID. And our fit testing process in N95s, eye protection gown and gloves when we care for those clients who are COVID positive or symptomatic awaiting COVID testing. So that's all part of that required PPE protocol safety strategy that's working so well. So thank you for wearing your PPE. Another core strategy is our COVID screening. And we all have been screening for signs and symptoms of COVID. And this is so important. And by doing so, you're not only protecting your client by not coming to work sick, you help discover early if you have an infection, so you protect your family and have the opportunity to check in with your healthcare provider on focusing on your recovery should you become COVID positive. Another core strategy is our testing protocols. And we know in several of our states, there's regulations and protocols to keep our vulnerable population safe, which is our congregate living settings. And we follow those protocols, which require weekly COVID testing of employees who enter those. So that is that other layer of core safety. And finally, our newest core safety strategy is COVID vaccination. And we are recommending everyone get vaccinated. We're helping you find opportunities to get vaccinated. And we thank you for getting vaccinated, as this is one more step that you can take to protect you, your family, and our clients against COVID-19, along with all of those other core safety strategies that we just looked at.
That's great. Thanks, Susan. It's really important to see these all together and to remind us that one or the other is not adequate. It's all of them together that give us the best protection for ourselves, for our families, for our coworkers, and for our clients. Thanks for shining a bright spotlight on that for us. I'd like to close as usual with some recognition of all of you that are out there finding your spot and getting your shot. One of the safety strategies that Susan just outlined. Every day, the photos are pouring in from employees that are finding ways to get their vaccination shot, first and or second. And it's great to see the momentum building and our organizational and employee safety building in the process. So thanks to everybody, and we will see you next week.